Welcome, ladies and gentlemen, to our next Tegrity recording. I'm going to do a short series on test-taking strategy. I find that a lot of students, once they get to Senior 1, realize that how we're testing them is changing and what we need, the mental gymnastics that you need to do for test-taking is changing. And so I want to make sure that you have an opportunity to get some instruction about how you want to think about a test question. We will be reinforcing this as we go through test review, but obviously you want that a little bit before the test, don't you? So we're going to take a stab at doing this on Tegrity. So some general test-taking strategy. First of all, I know this sounds dumb, but you need to look at the question first. And when I say look at the question first, what I mean is look at the question part and not the answer part first. The very first thing that you should be asking yourself is, what is this question asking me? Is it asking me what to do about these symptoms? Is it asking me what the diagnosis is? What is it asking me? Until you can answer that question, you should not be moving forward and looking at the answers. There is a fair amount of research that shows that students that aren't sure that they're very good test takers or they're not sure what's going on will go ahead and start scanning the answers before they even know what the question is asking them. And so you don't want to do that. That's not your best strategy. The next step is going to be to uncover the answers. So I'm always going to suggest that, we're taking paper tests in this class. Take your hand, cover up the answers until you can tell yourself what the question is asking you, basically what the topic of the question is. Then you want to uncover the answers. Look at the answer choices. We are going to encourage you always to get a right answer, not by just picking a right answer, but by eliminating wrong answers. Start eliminating things that don't make sense so you're not thinking about as many variables all at one time. If you have eliminated 3 answers and there's only 1 left, that is your answer even if you don't know why. You're going to pick what's left. Now don't get stuck. Don't change your answers. When I say don't get stuck, I talk to a lot of students who tell me the same thing. They say, I always get it down to 2 answers and I pick the wrong one. My experience is that many times when that happens, it's because you have misidentified the topic of the question, you have added something to the question that's not there, or you have missed some detail in the question. So if you're stuck between 2 answers, go back to your question and figure out again, see if you can figure out what it's asking you for, and make sure that the topic of your answer matches the topic of your question. Because if the topic of your answer is not the same as the topic of the question, then it's not the right answer. So let's do some practice questions and see if we can illustrate this point a little bit. The cardiac monitor of a 50-year-old client admitted for cocaine ingestion shows V-tach converting to V-fib. What is the priority nursing action to implement? The first question I want to ask myself is, what is the topic of this question? The topic is not that we have a 50-year-old patient. That is extra. The topic is not cocaine ingestion, and it's not V-tach. The topic is the problem that we have now. The problem is the patient has ventricular fibrillation. If our patient has ventricular fibrillation, I need to stop and think, what would I expect with that? Would I expect them to have a pulse? Would I expect them to be breathing? What are my priorities? So I need to know what is the priority action for ventricular fibrillation. That is the topic of the question. Prepare for intubation. Begin chest compressions. Start an 18-gauge peripheral IV. Place defibrillator pads on the patient. Okay, well, I'm looking at these answers and I'm thinking, well, I'm probably going to do all of those things. So I have to think about what to do first. If I think back to my ACLS algorithm, the very first thing after establishing unresponsiveness is to do what? Begin chest compressions. So I suspect that that's the answer. Let's make sure we can eliminate every other answer. So do you have to put an artificial airway or an advanced airway in every patient? Well, the answer is no. You don't always have to do that. So that eliminates answer choice A. That can't be my priority action if that does not have to be always done. Starting an 18-gauge peripheral IV, that sounds important. Are there other ways to get drugs in the patients besides a peripheral IV? Well, the answer is yes. So maybe that's not going to be my best choice. Do I need to put defibrillator pads on the patient? Well, absolutely I need to put defibrillator pads on the patient. So now I'm down to between B and D. Both of these are good options, but which one is going to get circulation around to my patient's brain and other organs? That's going to be B. My ACLS algorithm says CAB, circulation, airway, breathing, and compressions is going to be the first step. That's going to be my answer. Let's do another one. A client who has heart failure is admitted with a serum potassium of 2.9. Which action is the most important for the nurse to implement? So, first thing, what is the topic of this question? The topic is typically whatever the problem is. So, is heart failure the topic? Well, no. Heart failure is not the topic because I have another problem presented. My patient has a serum potassium of 2.9. Is a serum potassium of 2.9 normal? Well, no. I learned in Junior 1 that a normal potassium is 3.5 to 5.0, so my patient's potassium is very low. So now I have to think about what might happen because of low potassium. But the topic of my question is low potassium. So I have an option to give some potassium. I have the option to initiate continuous cardiac monitoring. I can arrange a consult with the dietitian or teach about the side effects of diuretics. Well, once again, I'm probably going to do all of these things. So if I've got 4 right answers, I've got to decide what the priority action is going to be. The first thing, the best thing. There is an assumption in test taking and nursing that the first thing you will do will always be the best thing to do, not the fastest thing to do. So if I think about what is the very worst thing that can happen in a patient with low potassium, that's going to be the highest priority, is to take care of that. So does teaching seem like that's going to be my highest priority right now? Well, if my patient has a physical problem now, talking to them about their understanding about something is probably not my highest priority, so I'm going to get rid of D. Same thing with C. I'm going to arrange a consult with the dietitian, maybe to work on potassium, but that doesn't mean that my patient is safe right now. I need to keep my patient safe. So A sounds like a good option, but so does B, because I know that patients with low potassium are at increased risk for tachyventricular dysrhythmias, PVCs and VTach. So if that's the worst thing that can happen is cardiac dysrhythmias, then I need to know if that's happening. I need to do B before I do A. I need to keep my patient safe while I treat their low potassium. That was kind of tricky. Let's do one more. A client who is admitted to the coronary care unit with an MI begins to develop crackles bilaterally, an increase in heart rate from 80 to 102 beats a minute, and cold and clammy skin. What action should the nurse implement? This is a very high-level question because it's going to require us to look at all of the symptoms and decide what we think might be happening to this patient. So a patient that's had an MI, I'm seeing crackles bilaterally in the lungs. So that indicates to me that there's some fluid buildup there. I have to think about why that might be happening. So when do you hear about heart patients having crackles? Well, with heart failure. And I'm like, but it doesn't tell me they have heart failure. It tells me they've had an MI. So let's keep reading. An increase in heart rate, cold, clammy skin. So I have to stop and think about why might that be happening. In this case, it does sound to me like the patient's having heart failure. They're having a decrease in cardiac output. That's why they're having cold, clammy skin. Their heart rate has increased to try to compensate for that. They sound fluid volume overloaded, but why in the world might that happen with an MI? Well, if part of their heart died, maybe they're having pump failure. So this sounds like, what is the priority action for acute heart failure? That is the topic of my question. So my options are to notify the healthcare provider, increase the IV flow rate, place the patient in the supine position, or prepare the client for emergency echo. We want to pick a right answer by eliminating wrong answers. So what can we get rid of right away? Well, B has got to be out. Even though it sounds like cardiac output is down, I also have evidence that my patient is volume overloaded, as evidenced by the crackles in the lungs. If I increase the IV flow rate, I could make my patient sicker and not better. So I'm going to eliminate answer choice B right away. I'm also looking at C thinking, that doesn't look like the right thing to me, because when a patient has crackles and they've had heart failure, one of the things that I want to worry about is maybe they're going to have shortness of breath. And what's the first thing you do for shortness of breath? Well, you sit them up. So my patient needs to sit up. I don't want to lay them down. They're going to have a harder time breathing. So now my only option is between A and D. So is an echo going to do anything for my patient that's having acute heart failure? The answer is no, it's not going to help them. I need to get somebody there that can issue some orders for my patient, maybe some diuretics or something like that. I need to choose answer choice A, notifying the healthcare provider. That is the end of our first series. There's a couple more to come. So hang in there, keep practicing questions, and we're going to keep reviewing the way to think about the questions.